My name is Maria. I am 102 years old, and I have held a human heart in my hands more times than I can count. For 78 years I stood under those cold operating room lights. I cut open chests. I stitched torn arteries. I brought people back from the edge of death. I have seen things that would make most people pass out on the floor. Blood doesn't scare me. Death doesn't scare me. But there were 3 patients, just 3, in 78 years of surgery, who broke something inside me that medicine could never fix. 3 patients who made me put down my scalpel, walk out of the operating room and cry like I was a child again. I never told anyone the full story. Not my colleagues, not my family, not even my own daughter. But I'm 100 now. My hands shake too much to hold a scalpel anymore. And I think it's time the world hears what happened behind those closed doors. Before I tell you about those 3 patients, you need to understand something about me. I became a surgeon in 1948. I was one of the only women in my medical school class. The men laughed at me. The professors ignored me. One professor told me on my first day, "Maria, go home. Surgery is no place for soft hands." I looked him in the eye and said, "My hands are not soft, sir. They are steady." And they stayed steady for 78 years. I performed my first solo surgery at the age of 26. It was a simple appendectomy, nothing complicated, but when I made that first cut, and I saw the inside of a living human body respond to my hands, I knew this was what God put me on this earth to do. Over the next 7 decades, I performed over 16,000 surgeries. I operated on newborn babies whose hearts were the size of a walnut. I operated on soldiers who came back from wars with metal still lodged in their spines. I operated on mothers, fathers, grandparents, teenagers. I saved thousands of lives, but I also lost patients. That's the part they don't tell you in medical school. They teach you how to cut. They teach you how to stitch, but nobody teaches you how to walk into a waiting room and tell a mother that her child didn't make it. Nobody teaches you how to carry that weight home with you at 2 a.m. I learned to handle it. I built walls around my heart, thick walls. Every surgeon does. You have to. Otherwise, this profession will eat you alive. In 78 years, I lost releasing patients. It happened. I accepted it. But only 3 times did those walls crack. Only 3 times did I completely fall apart. And each one changed me forever. Let me tell you about patient number 1. It was the winter of 1962. I was 38 years old, already considered one of the best cardiac surgeons in the state. A young man was brought into my hospital on a Thursday night. His name was Daniel. He was 19 years old. He had been in a car accident. A drunk driver hit him head-on while he was driving home from college for Thanksgiving break. When they wheeled him in, I could see it was bad. His chest was crushed. 3 ribs had punctured inward. His left lung had collapsed. But the worst part A fragment of his own rib had torn into the wall of his heart. Not fully through, but enough to cause a slow bleed that was filling the space around his heart and suffocating it. This is called cardiac tamponade, and it will kill you if someone doesn't open your chest fast. I scrubbed in within 12 minutes. When I opened Daniel's chest, I could see the damage immediately. The blood was dark, almost black. It was pooling around his heart like a rising tide. I worked fast. I drained the blood. I located the tear. And then I saw something that made my stomach drop. The tear was not in a place I could easily reach. It was on the posterior wall of his left ventricle, the backside of the heart, the most dangerous area to operate on. One wrong move and his heart would stop. I looked up at my team. Nobody said a word. I could hear his heart monitor. A slow, weak rhythm. I told myself, "Steady, Maria, steady." I reached in. I began stitching the tear with sutures thinner than a human hair. My hands did not shake. They never did. 15 minutes passed, then 30, then 45, and then I closed the tear. His heart rate stabilized. The bleeding stopped. I felt that familiar wave of relief. The surgery was going to be a success. But then his monitor changed. A slow beep, then a pause, then a slower beep, then a longer pause. His heart was failing. Not from the tear. That was fixed. Something else was happening. I opened the chest wider. I looked deeper, and then I saw it. There was a second injury, hidden behind the first, a tiny, almost invisible tear in his aorta, the main artery that carries blood from the heart to the rest of the body. It had been slowly leaking this entire time. I had been so focused on the obvious wound that I missed the silent killer hiding right behind it. I tried to clamp it, but the tissue was too damaged, too fragile. Every time I touched it, it tore more. His blood pressure dropped, then dropped again. The anesthesiologist looked at me. I saw it in his eyes. He knew. I knew. Everyone in that room knew. But I didn't stop. I kept trying for another 22 minutes. 22 minutes of fighting a battle I had already lost. And then his heart stopped. I stood there, my hand still inside his chest, holding an artery that no longer carried life. The room went silent. My nurse called time of death. 11:47 p.m. I didn't say a word. I pulled my hands out. I removed my gloves. I walked out of that operating room, turned the corner into an empty hallway, leaned against the wall, and I cried. Not because I lost a patient. I had lost patients before. I cried because Daniel's mother was sitting in the waiting room. She had driven 4 hours through a snowstorm to get to the hospital. And when she arrived, a nurse told her, "Don't worry, doctor. Maria is the best. Your son is in good hands." I keep thinking about those words. Your son is in good hands. My hands couldn't save him. That was patient number 1, and for the next 6 months, every time I closed my eyes, I saw that hidden tear, that tiny silent rip in his aorta that I should have found sooner. Maybe if I had found it 5 minutes earlier, maybe. That maybe haunted me for years. But patient number 2, that one nearly ended my career. It was 1979. I was 55 years old. By this time, I had performed thousands of surgeries. I had trained dozens of young surgeons. I had published papers, won awards. But none of that prepared me for what walked into my hospital on a Tuesday morning in March. Her name was Emma. She was 7 years old. She had a congenital heart defect, a hole in the wall between the 2 lower chambers of her heart. This is called a ventricular septal defect. It's not rare. We fix it with surgery. I had done this exact procedure over 100 times. Emma's parents brought her in. Her father was a quiet man, a mechanic, rough hands, gentle eyes. Her mother was barely holding herself together, but Emma, that little girl, looked up at me and said something I will never forget. She said, "Dr. Maria, are you going to fix my heart so I can run like the other kids?" I smiled at her and said, "Yes, sweetheart. When you wake up, you're going to run faster than all of them." She smiled so wide, missing 2 front teeth. I prepped for surgery that afternoon. Everything was routine. Everything was routine. Everything was perfect. I opened her tiny chest. I located the hole. It was exactly where the scans said it would be. I began the repair, and for 35 minutes everything went exactly as planned. The patch was holding. Her vitals were stable. Her little heart was beating strong. I was almost done, maybe 10 more minutes, and then one of my surgical residents bumped the instrument tray. It was a small bump, barely noticeable, but it caused a clamp to shift, and that clamp was holding a retractor in place near Emma's heart. The retractor moved. Just 2 millimeters. 2 millimeters, and it nicked the edge of her pulmonary artery. In an adult, this would be a problem, but manageable. In a 7-year-old girl with a chest the size of a shoebox, it was a catastrophe. Blood began filling her chest cavity faster than I could suction it out. I shouted for more suction. I shouted for clamps. My team moved fast. But her body was so small, there was no room to work. I could see her heart, this tiny, beautiful little heart struggling to beat while it was drowning in its own blood. I worked for 40 minutes. 40 minutes of trying to repair damage that should never have happened. And I did it. I stopped the bleeding. I repaired the artery. I finished the original surgery. When I closed her chest, her heart was beating. Her vitals were stable. I should have felt relief, but I felt nothing. because I knew something that nobody else in that room wanted to say out loud. During those 40 minutes, Emma's brain had been deprived of adequate blood flow. Not completely, but enough. When Emma woke up 3 days later, she couldn't move her left arm. She couldn't move her left leg. A lack of blood flow had caused a stroke. A 7-year-old girl had a stroke on my operating table. She would never run like the other kids. I lied to her. I told her she would run. I promised her. And my operating room, my team, my hands took that away from her. I didn't cry in the hallway this time. I drove home. I sat in my garage. I turned off the car. And I cried for 3 hours. I almost quit that night. I wrote a resignation letter. I signed it. But I never submitted it, because the next morning Emma's father came to find me. I expected anger. I expected screaming. I expected a lawsuit. But this rough man with mechanic's hands and gentle eyes looked at me and said, "Dr. Maria, you saved my daughter's life. She's alive because of you. We don't blame you. Please don't stop. Other children need you." That man put the scalpel back in my hand, and I never put it down again, not for another 45 years. But I visited Emma every single year on her birthday, every single year. She learned to walk again with a brace. She finished school. She got married. She never ran like the other kids. But she lived, and every year when I visited her, she said the same thing. "Dr. Maria, you fixed my heart. That's all that matters." But it wasn't all that matters, not to me, because every time I looked at her left hand, the one that couldn't grip properly, I saw that clamp shift, that 2 millimeters, that 40 minutes of chaos, and I carried it. I carried it every single day. That was patient number 2 now. Patient number 3. This is the one I've never told anyone. This is the one that still wakes me up at night, even now, even at 1:02. This is the one that made me understand something about life and death that no medical school could ever teach. It was 2003. I was 79 years old. Most surgeons retire in their 60s. But I couldn't stop. Surgery was my life, my identity, my purpose. I was still sharp. My hands were still jet. My mind was still clear. The hospital let me continue because my record was nearly flawless. One October evening, they brought in a woman. Her name was Catherine. She was 44 years old. She had been stabbed 3 times in the chest. It was a domestic violence situation. Her husband had attacked her in their kitchen while their 2 children were asleep upstairs. When she arrived, she was barely conscious. I scrubbed in immediately. When I opened her chest, the damage was severe. 1 stab wound had missed everything vital. Lucky. The second had punctured her right lung. Serious but fixable. But the third wound, The third one went straight into her heart, right through the right atrium. The blade had gone in and come out cleanly, leaving a wound that was bleeding freely. I worked on her for 2 hours. 2 hours of the most intense, precise, exhausting surgery of my entire career. And I fixed her. I repaired every wound. I stopped every bleed. I reinflated her lung. When I finished, her heart was strong. Her breathing was stable. She was going to survive. I walked out of that operating room feeling something I rarely felt anymore. I felt proud. I was 79 years old and I just saved a woman's life in a surgery that would challenge doctors half my age. Catherine recovered over the next several weeks. I checked on her every day. She was getting stronger. She was smiling. She told me about her 2 kids, a boy 12 and a girl 8. She told me she was going to leave her husband, start over, build a new life. She held my hand one afternoon and said, "Dr. Maria, you gave me a second chance. I'm going to make it count." I believed her. Catherine was discharged on a Wednesday morning. I remember watching her walk out of the hospital with her sister. She turned around and waved at me. I waved back. 11 days later, I got a phone call at home. It was a colleague from the hospital. He told me that Catherine was dead. Her husband had found her. He killed her. This time there was no operating room, no surgeon, no second chance. She was gone. I hung up the phone, and for the first time in my career, I didn't just cry. I screamed. I screamed into a pillow in my bedroom like a woman losing her mind, because I realized something that shattered me. I had spent 2 hours rebuilding this woman's heart, stitch by stitch, so that a monster could destroy it again 11 days later. My surgery didn't save her, it just delayed her death. All those years of training, all that skill, all that precision, and it meant nothing. Absolutely nothing. Because the thing that killed Catherine wasn't a medical condition. It wasn't a hidden tear or a shifted clamp. It was something I couldn't cut out with a scalpel. It was evil, plain human evil, and there is no surgery for that. That was patient number 3, and that was the night I understood the limits of medicine. I could fix hearts, I could repair arteries, I could stop bleeding, but I couldn't fix the world. Those patients had to go back to. That is the truth they never teach you in medical school. You can save someone on the table, but you cannot save them from what's waiting outside the hospital doors. I'm 102 years old now. I performed my last surgery when I was 86. I have lived a long life, a full life, a life soaked in blood and stitched together with purpose. I don't regret becoming a surgeon, not for 1 second. But if you ask me what 78 years of surgery taught me, it's not how to hold a scalpel. It's not how to read an X-ray. It's not how to stitch a wound. It taught me that the most dangerous thing in an operating room is not the disease, it's hope. Because when you give someone hope and the world takes it away, that's a wound no surgeon on earth can fix. Thank you for listening to an old woman's confession. I hope you carry something from my story into your own life. Hold the people you love a little tighter tonight. Because I spent 78 years learning one thing. Life is fragile, and no one, not even a surgeon, can promise you tomorrow.